this slide, explain about introduction of tennis elbow. Sport injury can sustain when participating in sport or exercising. The common injury in sport involve part of the body such as knee, ankle, lower back, shoulder and elbow. So we create SOAP notes to athletes who suffer elbow injury, which is tennis elbow. Tennis elbow also can define as lateral epicondylitis, which is a painful ailment that develops when the tendon in your elbow are overworked, generally because of repetitive wrist and arm motion. Condition in which the tendon of forearm muscle connect to a bony protrusions on your outside of your elbow, causing discomfort.
Hi, my name is Mashita Binti Sega Airlines Abi Rauf. I'm from SR1134A. My matric number is 2019258604. Okay, now I'm going to explain about the anatomy of injured area. As we know, tennis elbow is an injury that involves the tendons in the elbow. However, there are several muscles and bones involved in this injury. Okay, for tendons, as we know, the tendons involved are extensor carpi radialis brevis, while for bone involved in this injury are humerus, radius, lateral epicondyle, ulna and olecration. Okay, for muscle, there are 4 types of muscle in the forearm involved, which is extensor carpi radialis brevis, extensor carpi ulnaris, extensor digitorium, and the last one is extensor digiti minimi. Okay, now I'm going to present about subjective. Okay, what is subjective? Subjective is the first procedure or step listed in the SOP notes to identify, analyze, and issue an accurate statement or documentation about an injury faced by an athlete. Okay, for your information, subjective is an initial process or procedure which asks to obtain information about injuries suffered by athletes. At this stage, it is necessary to obtain the injury history and also the symptom experienced by the athlete himself. I will explain the athlete injury history first. Okay, for the impression of the athlete state that at first he felt very pains and tense in the elbow. The pain he felt was getting worse when he did the throw. Aside from the pain, then the athlete stated that he also felt muscle soreness, which to some extent inhibited his movement to continue doing the throw while training. He also said that he suffered this injury while pitching, which required rapid and frequent hand and elbow movement. Athlete stated the injury he faced affected him daily activity, and the pain he experienced was throughout the day. Okay, now for side of pain, this athlete has pain in the elbow tendon, or can be said to have suffered an injury to the lateral epicondylitis, in which there is a tear in the tendon of the elbow. Okay, for mechanism of injury, some of the factors that drive athlete to suffer such injuries are pressure applied to the elbow repeatedly while doing throws in training and competition. In addition, the athlete also stated he was also not adequately stretching and warm up, causing the injury to occur. Okay, finally, overuse, which is where the athlete has used the force on his hand excessively to gain high momentum during throw. Okay, finally, the previous injury the athlete also often experienced is a forearm cramps. The athlete said that almost every time he trains or in a competition, he will tend to get a forearm cramp. Okay, now I will explain to you about the behavior symptom, which is the terms that must have in the subjective in the SOP notes. Information, the athlete has told every symptom he experienced throughout the injury. For example, like the athlete felt burning pain on the upper part of the bone on the side of the elbow. The athlete also said that the pain felt spread from the elbow to the forearm muscle up to the wrist. For your information, to know more about the the severity of the symptoms that the athlete face, we have provide the scale, which is the severity of symptom scale to the athlete, rate their severity of the symptom. Okay, in this situation, he stated that his pain level is 5 out of 10, which is in the moderate phase. Okay, the other symptom is microtrauma, in which athlete experience pain, tenderness, muscle stiffness, and swelling on the injured part. Finally, the athlete said that he also feel pain when hold or grip an object, whether it is light or a heavy object. It doesn't matter if in a short time or long time. Okay, so that's all from me. I will pass to the next presenter. Thank you.
In this slide, I will talk about the objective of the test to detect the tennis elbow injury. For the first test is palpation. During a physical examination, palpation is a means of feeling with the fingers or hand. The healthcare professional examines the size, consistency, structure, location, and tenderness of an organ or body part by touching and feeling it. Note any tenderness in the olecranon and epicondyles by palpating them. The olecranon bursa is normally not palpable. Wrist flexion or extension might increase the pain of epicondylitis. Between the medial epicondyle and the olecranon is the ulnar nerve, which is generally painful to touch. Any nodules, thickening, or swelling of the synovium between the olecranon and epicondyles should be noted. The result is the patient feels pain in the part of olecranon and epicondyles after palpating him, and when wrist flexion and extension. For the second test is range of motion test. This exam assesses the range of motion of the body in a variety of functional movement patterns. The elbow moves in flexion and extension, allowing for forearm to supination and pronation. Normal range of motion testing effectively exclude out the elbow joint as the source of the problem when there is swelling or pain in elbow region. Firstly, the patient needs to perform an active range of motion to identify the extent of flexion and extension of the elbow. The term painful refers to pain that develops during range of motion but disappears when the limb goes past this point in either direction. After that, the patient needs to do a different range of motion to measure the amount of movement in a joint of body part to see if there is a limited range of motion. By getting help from trainer that are responsible to help the patient to move his elbow and forearm, the result is the patient has an abdominal range of motion limit where the elbow cannot be stretched until the normal range of motion. For the last test is Cowan test. The Cowan test, also known as the resist wrist extension test or resistive tennis elbow test, is used to determine if you have lateral epicondylalgia, also known as tennis elbow. The trainer uses his thumb to support the patient's elbow while palpating the lateral epicondyle. The patient is next requested to actively create a fist, pronate his forearm, and radially deviate and extend his wrist against the trainer counterforce. The repetition of pain near the lateral epicondyle will be a positive test. The result is the patient feel pain repeatedly when performing forearm pronation, radial deviate, and extend his wrist. So that's all for the test. For the next slide, I will talk about the assessment of this topic. The injury started when Mr. Imran played softball. He felt pain at elbow and muscle soreness for the whole day that affected his daily movement. From the analysis, this happened because of his was overused his elbow in training and match, not adequately stretching and warming up, and had pressure applied to the elbow repeatedly. The patients show some of the symptoms such as pain burning, microtrauma, tenderness, muscle stiffness, and pain when hold or grip object. The symptoms show that might have tennis elbow since he have often experienced forearm cramps. There are 3 tests to detect what kind of injury he had. Firstly, palpation that used by examiner to checking where the pain he was experiencing. The examiner palpated on olecranon and epicondyle, and the result was he felt pain after the pipe was palpated and moved. Next test is range of motion test to assess the range of motion of the elbow in a variety of functional movement patterns. This result show that his range of motion of elbow had decreased after the elbow had been flexed and extended. For the last test is Coven test that used to determine if the patient suffer tennis elbow or not. The result of this test show that he feel pain when do several movements in this test, which is forearm pronation, radially deviated, and extend his wrist. After each test was performed, it was found that the patient had tennis elbow and need to follow the next step, which is recovery session. So that's all for assessment.
Okay, next we proceed to the treatment plan. Okay, in this part we're going to know that how we want to start recovery the injury. Okay, first thing first, we need to know what is component that have in treatment plan. Okay, first we have problem. Also we have a goal. Okay, for goal, it is what we want to achieve in this plan. Okay, so the goal had provide objective like phase that we want to achieve phase by phase. So for objective, it has provided period time. So in one objective, we have target a period time to achieve. So after achieve the objective 1, we're going to proceed to achieve objective 2. Same goes to another objective. So we have intervention. Okay, intervention like mechanical, like additional aid that we put in the treatment plan, like advice from clinician and others. So in this treatment plan, we must plan correctly, because we need to heal the patient in a perfect duration time. So we proceed to the treatment plan. So for the problem is, it hard to do various exercise that involve hand because of tennis elbow. So the goal is, we want to healing the injury and come back to do normal activity like usual without pain. Okay, so for the objective 1, we want to able to move the hand like normal without weight to gain the momentum back. So we have objective established. So for target objective established, we target at 25 July 2021 and target completion on 26 August 2021. So for objective 2, we had provide to able to use carrying weight in a moderate range motion to build up strength. So we had provide objective established at 27 August 2021 and target the completion on 29 September 2021. So objective 3, we need to achieve that 90% recovery from the injury and able to do daily activity with full of precaution. So we target at objective established at 30 September 2021 and target completion at 29 October 2021. So for intervention, clinician will provide education about high risk situation, supplement required and nutrition in as supporting to completing the plan. Intervention will be provided during a individual session. So, for this treatment plan, we have provided frequency 60 minutes per week, and we target this treatment plan can be done just in 3 months. So that's all for treatment plan. Okay, according to the treatment plan, every injury had different type of exercise that can perform. It depends on what target muscle it involves. Do the following exercises depends on program had provided to improve strength, prevent and treat discomfort and increase flexibility. Gradually increase the amount of time you spend on it. Perform this kind of exercise before and after any stressful or strenuous activity. Be careful with ourselves and don't push any of our move while practicing this exercise. We may feel like feeling itches and some discomfort, but it should not be severe. Okay, so it's a tip for don't do this exercise during this injury. Activities that require repetitive gripping motion such as throwing, rock climbing, racket sports or weight training, because it can often lead to tennis elbow. So, in this slide, it had provided a kind of exercise that can be done for tennis elbow, such as it's a kind of for stretching and strengthening. So that's all for exercise that can be done for tennis elbow. Okay, now we proceed to the rehabilitation program for 12 weeks. Okay, first of all, this rehabilitation program, we refer to the FIT principle, which is F for frequency, I for intensity for type of exercise, and T for times. Okay, so we go into the first week for rehabilitation program. So for first week, it show that it do on Monday, Wednesday, and Tuesday and Friday. So and in the intensity for this week, only from 10% to 30% of repetition max or RM. So what exercise that do in Monday? The exercise is finger stretch, isometric wrist extension and flexion for 30 seconds for one set. And for Wednesday, same like Monday, finger stretch, isometric wrist extension and flexion for 30 seconds and one set, but has one new exercise which is wrist curl for 5 reps for 3 sets. And for the Friday, last exercise for week 1, it had finger stretch, isometric wrist extension flexion for 30 seconds in one set, and wrist curl for 5 reps in 3 sets. Okay, proceed to next week, which is week 2. Also, it occur in Monday, Wednesday, and Friday. The intensity same like week 1. And for Monday, it had finger stretch, isometric wrist extension and flexion for 30 seconds in one set. Wednesday, finger stretch, isometric wrist extension flexion, also 30 seconds one set. And Friday had a wrist curl for 5 reps, 3 sets. Finger stretch, isometric wrist extension flexion for 30 seconds one set. And back to do a wrist curl 5 reps in 3 sets. Okay, we proceed for week 3. Okay, in week 3 we can see in Monday, Wednesday, and Saturday. Okay, for Monday we have finger stretch, isometric wrist extension flexion. We will do 30 seconds for one set. Okay, for Wednesday also we have finger stretch, isometric wrist extension flexion also 30 seconds for 1 set. And for the last day for week 3, we have finger stretch, isometric wrist extension flexion for 30 seconds 1 set, and have one new exercise which is wrist curl for 5 reps and in for 5 sets. Okay, for week 4, in Monday, we have finger stretch, also isometric wrist extension flexion for 30 seconds in 1 set. And we have a new exercise which is elbow curl. Okay, this elbow curl will be done for 5 reps for 3 sets. And for next day, which is Wednesday, we have finger stretch, also isometric stretch, wrist extension and flexion. We will done 30 seconds for 1 set. And for the last day for week 4, which is we had elbow curl, it will be do 5 reps for 3 sets. Finger stretch and isometric wrist extension flexion. We will do 30 seconds for 1 set. And so that's all for week 3 and week 4. Okay, we proceed for week 5. Okay, in this week, we'll change the intensity because we need a progression. For this injury exercise, it had not many type of exercise, so we will change we will change at the intensity, because the intensity can be a main component in this progression. Okay, so for Monday, we have wrist stretch. So this wrist stretch we will do 20 seconds for 2 sets. Also wrist curl, we'll do 5 reps for 2 sets. In Wednesday, we do a finger stretch and isometric wrist flexion extension for 30 seconds for 1 set. And for the last day for week 5, which is elbow curl and wrist curl, we will do a 5 reps for 3 sets. Okay, for week 6, the intensity is same like week 5, which is 40% to 50% of repetition max or RM. Okay, for Monday, we have finger stretch with bend. Okay, this exercise will put a variation because we need a progression. So we put some assistance because it will help to increase the strength for and build up the strength for this injury. Okay, so we have finger stretch with bend, which will do 50 seconds for 2 sets. Also, we have elbow curl and wrist curl and do for 5 reps for 3 sets. Okay, for Wednesday, we have finger stretch with bend. We'll do for 50 seconds 2 sets. And we have a wrist curl with 1 kilo dumbbell. Okay, this also we put a variation. We give a little bit assistance because of progression. So wrist curl with 1 kilo dumbbell, do 5 reps for 3 sets. Also, for the last day of week 6, wrist curl with 1 kilo dumbbell for 5 reps 3 sets. Okay, that's all for week 5 and week 6. Okay, we proceed for week 7. Okay, in week 7 we can see that intensity same like week 6. Okay, in Monday, so we can see that we have a new exercise which is forearm twist, and also we have a finger set with bend. Okay, for this two exercise we do 30 seconds for 2 sets. Also for next day, which is we have elbow curl with 1 kilogram dumbbell, also with wrist curl with 1 kilo dumbbell, and we'll do these two exercises. We'll do 5 reps for 3 sets. And for the last day, for last day week 7, we can see that we have a forearm twist, and we will do 30 seconds for 2 sets. And we have a elbow curl with 1 kilogram dumbbell, and we will do 5 reps for 3 sets. Okay, and we proceed next week, which is week 8. Okay, and week 8 we can see that in Monday we have a wrist stretch and a new exercise which is towel twist. Okay, So this two exercise will be do 20 seconds for 3 sets. Also with a wrist curl with 1 kilogram dumbbell, we'll do a 5 reps for 3 sets. For the next day we have also towel twist, we'll do 20 seconds for 3 sets. And we have elbow curl with 1 kilogram dumbbell. We will do 5 reps for 3 sets. And the last one we have a wrist stretch and also towel twist. We'll do a 20 seconds for 3 sets, and with has also a wrist curl with 1 kilogram dumbbell. We will do a 5 reps for 3 sets. Okay, that's all for week 7 and week 8. Okay, we're going to the next week, which is week 9. Okay, in week 9 we can see that it has changes in intensity. Like I said before, we need a progression. Okay, for this intensity for week 9, it had changed to the 60% to 80% of repetition max or RM. Okay, for Monday we can see that we have a towel twist that will do 50 seconds for 5 sets. Also we have an elbow curl with 2 kilogram dumbbell. We will do 4 reps for 2 sets. And we can see for the next day we have a wrist stretch and also towel twist. We will do a 50 seconds for 5 sets, just 2 exercises. And for the last day for week 9 we have a wrist curl with 2 kilogram dumbbell, and we will do a 4 reps for 5 sets. Okay, we proceed to the next week, which is week 10. Okay, in week 10 also the intensity is same like week 9, from 60% to 80% of repetition max. Okay, for Monday we can see that we have a towel twist. We'll do 50 seconds for 5 sets. Also we have forearm pull. Forearm pull is a new exercise. We will do 6 reps for 2 sets. And for the next day we have finger stretch, just finger stretch, do not have a bend. We'll do a 10 seconds for 6 sets. Also we have a forearm twist. We'll do a 10 seconds for 3 sets, just 2 exercises. And for the last day for week 10 we have a towel twist, also a forearm twist, which will do a 50 seconds for 5 sets. And the last exercise is forearm pull. We'll do a 6 reps for 2 sets. Okay, that's all for week 9 and week 10. Okay, we proceed for week 11. Okay, for week 11 the intensity is same like week 9 and week 10. Okay, in Monday we can see that we have a towel twist, also forearm twist, that we can will do 50 seconds for 5 sets. Also we have a forearm pull with 1 kilogram dumbbell that we'll do for 5 reps for 2 sets. Okay, for the next day we have a wrist stretch, also a towel twist. It will do a 20 seconds for 3 sets. And we also have a wrist curl with 2 kilogram dumbbell. Okay, so you can see that it had additional or in a resistance from 1 kilogram to 2 kilogram. Okay, it will do for 4 reps for 5 sets. Okay, for the last day for week 11 is Friday. Okay, we can see that we do a towel twist and a forearm twist for 50 seconds for 5 sets. Okay, we also have a forearm pull with 1 kilo dumbbell, and we will do for 5 reps for 2 sets. Okay, we proceed to the last week of rehabilitation program, which is week 11. Okay, this week had a changes in intensity to the 80% to 90% of repetition max. Okay, for Monday we can see we have a stress ball squeeze. It's a new exercise. We will do a 10 seconds for 5 sets. Okay, we also have a wrist curl with 2.5 kilogram dumbbell. Okay, from 2 kilogram is up to 2.5 kilogram dumbbell. Okay, we will do 5 reps for 5 sets. Okay, next day, Wednesday, we can see it has a towel twist and a forearm twist, and it has will do a 10 second for 5 sets. Also, we have a forearm pull with 2 kg dumbbell. Also, it will do a 3 reps for 5 sets. And the last day for the week 12, which is Friday, we can see it has a finger stretch with bend. We will do for 20 seconds for 4 sets. And also we have a elbow curl with 2 kg dumbbell, and we will do a 4 sets for 5 reps. Okay, so the rehabilitation program that I have planned is refer to the progression from begin to the ending. So you can see in the table, 4 week for the first 4 week, we have put a low intensity. So for the next 4 week, we put a moderate, and the last week we put a high intensity. So this we plan must make sure it have progression, because we need to achieve the goal from the treatment plan that we planned before. So that's all from me. Thank you.
To conclude the presentation, SOAP notes is effective way and technique of documenting into diagnosis injury of the athletes. It allows us to assess the progression of the element's condition and the treatment that is being received. The researcher can monitor outcomes before and after therapies using this diagnosis. Following that, the researchers may learn more about the structure of the damaged body part by going through all the SOP steps notes.